interesting. Well, now you've spoken very eloquently about kidney disease, but can you tell me who is at risk? Is it just the elderly or young folks?
No, it's in fact it's young folks too. And you know, we talked about, you know, can you as you age, can you reduce the loss of these filtration units? You can by taking good care of yourself, and I'm going to talk about that in a minute. But the people that are at risk are people who have diabetes, people who have high blood pressure.
Right, you mentioned that.
People who have a family member with kidney disease are at risk also. Also, certain ethnic groups are at risk too. African Americans,
Okay.
Native Americans are at risk, Pacific Islanders are at risk. So it's certain ethnic groups. Hispanic people are at risk too for chronic kidney disease, higher risk
Right.
than other ethnic groups.
And it is hereditary, you said. That it does run in families?
Can be hereditary. There are certain types of kidney diseases that are hereditary. Polycystic kidney disease is inherited from your mom or your dad.
Okay.
There's also kidney diseases that are what's called autoimmune that can go in and attack your kidneys, like lupus. People can have a lot of bladder infections or a lot of kidney infections that can increase your risk of chronic kidney disease. People who have repeated kidney stones are at risk of chronic kidney disease. So it's a number of groups that are at risk. But in this country, 2/3 of kidney disease is from diabetes and from high blood pressure. So those individuals are particularly at risk.
Right, so very important to make sure you get your blood pressure checked on a regular basis and know if you have diabetes type 2.
Correct.
And obviously follow your doctor's instructions in regards to that.
Correct.
The blood pressure, very, very important.
Yes, and I tell a lot of our patients to make sure they monitor at home too. So it's very easy with a home blood pressure
That's true,
kit.
yes.
Yes.
The technology that we have today, it's much easier than it was 20 years ago to be able to monitor your own blood pressure at home.
It is.
And so you encourage people to do that on a daily basis?
I do. I do. I work in kidney transplantation. We discharge patients on blood pressure medications. So we get a cuff for them, and we encourage them to monitor at home.
Right.
Not as diligently as we do in the hospital, but certainly daily when they first go home, but at least a couple times a week. And anybody on high blood pressure medications should monitor their blood pressure at home a couple times a week.
I was just going to say, right, should be checking it anyway, right?
Yes.
So, good idea.
Yes.
Ah, and can you give folks an idea of what a unit like that might cost and where they might find one? I would imagine just about any drugstore would
Yes, that's right. They're pretty reasonably priced today. You can go to any drugstore to purchase it. You can go to Walmart and purchase it, or a discount, Target, any discount store to purchase it. And you probably can purchase a pretty reliable blood pressure cuff for well under $50.
Okay.
So.
All right. We were going to say 100, so that's about half of what I was thinking. So
well, you can get very
$150.
sophisticated with things that for more money, but you can get a pretty reliable.
You can get a good one for under $50.
Yes. Most insurances will not pay for blood pressure cuffs.
Okay.
So
there's something you have to pay out of pocket, but that's very reasonable.
Yes.
Very reasonable. We're getting a question here, and this is in regard to kidney stones, which you just mentioned. What about kidney stones? What the heck are these really, and can they be passed, or do they need to be removed surgically? I hear they are very painful, and I want to be sure I never get one. Obviously, you haven't had one.
That's good.
I hope you never get one, but very good question.
That is a good question.
Go right ahead and take a stab at that one.
Kidney stones are made out of two things. They can be made out of calcium, or they can be made out of a substance called oxalate, and they're more prevalent in the summer months. What happens in the summer months? Yeah, people become dehydrated, so their kidneys aren't flushing all the time. So they, in fact, in August, they tend to be more prevalent.
I did not know that.
Yes.
Really?
Yes.
Huh.
Now, some people, by their makeup, they have metabolic reasons why they pass kidney stones. But other people get kidney stones because they can become dehydrated. So it's very important to hydrate during the summer, especially when you're sweating. So keep well hydrated. Water is always a good beverage to keep hydrated with, but never overwater yourself.
Got my water here.
Yes.
I think I'll take a drink.
Yes. Just like a plant, you don't want to overwater, but people need to drink different things because you can get water intoxication. So it's important to drink, to hydrate during the summer months. It's also important to keep your weight under good control. And make sure that you report, and they are painful. Kidney stones are very painful. And if people have any signs of, it's usually flank pain or they have blood in their urine, they want to make sure that they call their primary care doctor up promptly.
Sure.
They can pass them on their own.
I was just going to say, and as far as the question regarding them passing a stone, they can pass them, and a lot of times they do, right? They
Yes.
all have to be surgically removed.
The smaller stones are able to pass on their own. If it becomes a very big stone and it
Probably not.
obstructs
Sure.
the urine flow out, then they do have to be removed surgically or by lithotripsy.
But even a really small one can be very, very painful.
It sure
from what I
can.
understand. Very painful.
That's what my patients tell me.
So yes, well, so we certainly don't wish that on anyone.
No.
But, what generally happens is that there is a great deal of pain, but then once it's passed, the pain, as I'm told, it almost goes away instantaneously.
Yes,
Is that
it
right?
does.
Mhm.
Yes, it does. It's intensely painful.
Sure, right. And they can come back too, is that right?
They can come back, and once you have them, they do tend to come back. You have to be careful you never take excess calcium too. You know, some people think that if you take a calcium supplement, the more you take, the better it is, and
better
that's
for your
not.
bones, right,
It's
not
not the
necessarily
case. You have to be
so.
moderate in if you're going to take a calcium supplement. Only take the recommended amount.
Right.
So, because you can get calcium stones from calcium supplements.
Sure. Okay, well, that's a good thing for everyone to know.
Yes.
Don't overdo on the calcium, and be sure to stay hydrated, right?
Correct.
So really, that's about the best things you can do.
Yes.
As far as trying to avoid kidney stones.
Correct.
And some people are just more predisposed
Prone to them,
that,
yes.
right, than others.
That's correct.
I imagine, right.
Yes.
But again, don't overdo with the water, but hydrate.
Hydrate. Yes.
Yeah.
Yes.
Well, that makes sense why August that there would be more, but I
Yes.
didn't know that.
Yes.
Very interesting. Gosh, well, thank you for sharing that. Thank you for your question. I hope that has answered it. I would like to ask something else, and that is, we were talking about kidney disease and who was at risk, and my question is, how do you know if you have it, and what are some of the signs? Are there any symptoms? Because I know I mentioned during the segment that there really aren't a lot of symptoms.
Correct.
And maybe you can enlighten us a little bit more on that.
It's sort of similar to having high blood pressure. You really don't have symptoms of it until it's very, very high. Then people may have headaches and so forth. Chronic kidney disease is the same way. You may not have symptoms until it's fairly advanced. But some of the symptoms that people could have as the kidney disease progresses, they can be fatigued because they're anemic from the lack of red blood cells. They may get very puffy ankles and calves, and when they wake up in the morning, they may have puffiness around their eyes.
Oh, around their eyes, okay.
Yes.
Okay.
Their blood pressure may be high because their kidneys are failing. Now, high blood pressure can cause kidney failure, and kidney failure can cause high blood pressure in many cases.
Okay.
So those are some of the quieter signs that you may see. Some people may have some trouble concentrating because of the waste products have built up in their bloodstream, and it affects the way they think. They may have a poor appetite. They may.
Concentration is a symptom then.
Yes, concentration can be a symptom
Right.
of it too. But again, not usually till it's somewhat advanced.
Okay, all right. Well, go ahead, I didn't mean to cut you off.
They may have some muscle cramping at nighttime. So that may relate to their calcium balance in their body.
Sure.
Their skin may be dry and itchy, and usually you see that in probably more advanced phases of kidney disease. And some people have to get up to urinate more often, especially at night.
All signs and symptoms, right?
Yes.
Well, and as you were going through those, I was thinking to myself, all the more reason to have an annual physical.
Absolutely.
Because I know I talk to so many people that say, well, I feel fine, why do I need to go for a physical?
Right.
No, I don't need to go for a physical, or I haven't had a physical in 10 years, and they speak as though they're proud of that.
Right.
And so this is another reason why I think, and I think you would agree with me, that it's very important to
Yes,
see your doctor.
Yes.
Because they look for these things that you may not be exhibiting any signs or symptoms of, right?
They do. They do. They check your blood pressure. They check your weight. They look for any signs of excess fluid on you. They do a lot of primary prevention strategies with you that are good. So the seeing your healthcare provider every year, I think, is a great idea.
Thank you. I'm glad you agree with that.
Yes, I agree with you.
Annual physical, very important.
Yes.
If you're due for one, make an appointment.
Yes.
All right. What does a diagnosis of kidney disease mean for your lifestyle, especially for folks, say, over 50? How are things going to change?
Well, there's a lot of things you can do to slow the progression once you're diagnosed with it. Of course, the most effective strategy is to prevent it right from the get-go. So looking at controlling your weight, controlling your blood pressure. When you have diabetes, controlling your blood glucose. Avoiding medications that can be toxic to your kidney are really important in preventing the progression of it. The other thing that you can do once you're diagnosed is to make sure you're tied into your healthcare provider and you go back to see them on a routine basis. That's very important. The other important thing that you want to make sure that you do is to have blood work done when you need to have blood work done. Some people need to have monthly blood work done as their kidney disease progresses. You want to make sure you monitor your blood pressure and take your medications.
Right.
And you don't forget to take your medications. And if you have to have any tests that involve dye studies, like a CAT scan that involves some dye, or a cardiac catheterization, make sure your doctor knows that you have chronic kidney disease, because they can do some strategies to prevent more damage to your kidneys when they do those studies.
Yes. Very important.
And most important of all, don't smoke.
Okay.
Smoking pushes the kidney disease to progress faster. And they've done a lot of studies, particularly in people who have diabetes.
Wow.
Because it affects your blood vessels. And you have lots of very beautiful blood vessels in your kidney.